Hey guys! Oh my gosh!
Hey everyone!
Welcome.
Welcome.
Ready.
We're settling in.
Yes, we're here at my studio. It's Collab Media Studio at Venture X. So if you want to have a situation like this and talk about your product or service, give me a shout.
Yeah, she's your girl.
Yeah,
she's amazing.
And today, who do we have? We have. It's episode 3. You know what? We'll do a little bit of an intro because Dr. Shari is literally at her clinic. I just saw her this morning.
And did a treatment that we're going to be talking about.
Yes, we did. I did 2 treatments, and I think both of them are really relevant.
Yeah,
and I cannot wait to share with you my results so far.
Yeah.
But today we're talking about HRT in perimenopause, and for those who don't know what that is, it's Hormone Replacement Therapy, and weight gain, low energy, hot flashes, brain fog and libido.
All the things.
And whether or not HRT is the missing piece to solve the perimenopausal challenges that we have.
And when you go to your doctor and you get told your blood work is fine, it's perfect lab, then what do you do? How do you maneuver through that and what's actually going on? And Shari's going to be explaining everything that is probably in your mind right now. Hi, we love you.
Yeah, we're close enough that we can actually see.
Yeah, this is great. Actually, this is better.
Yeah,
now we can
really
see comments. Before we were kind of further back.
100%.
Except, okay, there we go. Let's see if this works. I've never had an issue.
No.
Right. I don't know. You know, technical difficulties always a pain in the ass.
All the live technical difficulties, eh?
All right. You go ahead.
That's life.
I got to reset this here. Okay.
Yeah, so Carm's just going to reset the TikTok. But yeah, welcome, Shari.
Sorry, I'm just playing around getting my stand. Sorry.
For sure. Get yourself situated.
Hold on a second.
1 second. Oh, yeah, don't mess up. Okay. Perfect.
Perfect. All right, we are good to go.
You're good? Perfect.
Okay, we
Perfect.
made it. Maybe just center a little bit. There we are. There we are.
Perfect.
Welcome. You know what? This is real life. This is not. This is social media. This is the truth. This is what happens. We're
All right, I think we're good now.
Together. Yeah.
It's like our hormones. Things can fall apart at any moment.
Okay. It's
and is there a way to get like the writing to go away? Or okay, it is what it is.
You're good.
All right.
You're perfect.
You're good. Okay.
All right. Can you guys hear me well and everything?
Yeah.
Perfect.
You are perfect. All right. We already did an intro, and just for everybody's sake, we're going to put in the actual account of the VitalityMD Toronto clinic, because that is where Dr. Shari Caplan is live streaming from. We are so honored for you to be here today because this is such an important conversation and very relevant to women my age, yourself as well, right? I'm in active perimenopause, and you know what? Let me throw that question to you first of all, Shari. When does perimenopause start and finish? I know it's different for everyone, but maybe you can just start with that.
Okay, so I'm going to sort of say that, you know, regular conventional medicine originally felt that perimenopause was like the 2 years, maybe 5 years before menopause, and the average age of menopause keeps shifting and is shifting earlier, but I'm going to say around 55. But in reality, we're looking at 12 to 15 years. So it can early start in the late 30s. So you can have someone, you know, trying to get pregnant and then has a baby, and then boom, their cycle stops, or they start, wreaking havoc with their mood and everything else. And a lot of women could be in perimenopause when they're still cycling. And so a lot of people are like, you know, if you're cycling, you're not in perimenopause, but that is not true. the first hormone to really go out of whack is progesterone. And progesterone is your natural tranquilizer and sleep aid. So a lot of women, what they might notice is that, you know, they're more irritable, they can't sleep, they get more PMS. An obvious sign that like gynecologists will recognize is the heavier periods. Periods could be shorter, they could be longer, they could be continuous, like anything and everything can happen. And I think, you know, regular family docs and gynecologists are really good at identifying the heavy bleeding, you know, stuff that happens like the fibroids or the endometriosis. But they really, maybe up until now, really ignored all the other signs and symptoms. So we have hormone receptors like estrogen and progesterone on every cell of the body. So it affects the brain, it affects the collagen, the tissues, the breasts, you know, the joints. So women, and, you know, the heart. And, you know, one of the big complaints that a lot of women get in perimenopause is they get palpitations. And they end up in a merge and like they don't know what's going on. And really the estrogen progesterone plays on the QR complex, like which is the electrical beat of the heart. And so that's why you can actually get more arrhythmias. So, you know,
Is that dangerous?
well, it's not necessarily dangerous. It's more symptomatic. And then, like, you know, when you're having either pauses or extra beats, you don't feel well, you don't know what's going on, you can feel dizzy and lightheaded. And there's ways to sort of manage it, but often it's missed that
Yeah.
it's actually because low progesterone at that point or something like, you know, that there's a hormonal imbalance. So, really, you know, perimenopause can present as almost anything. And I think that I'm thrilled to see that finally, you know, the world is paying attention a little bit more to perimenopause. You know, I think so many women suffer and they're told they're normal. And really, that's not the case. And, you know, your blood work may look totally perfect, but really, you know, it's like there's been a change. And then because it affects everything, then that's where, you know, our mood or anxiety or ability to cope with stress, you know, our weight, our metabolism, everything sort of gets affected.
Yeah. Why is that the blood work can come back great, but then you don't feel great? Like, what's the disconnection there? Like, wouldn't your blood work tell you, look, this is what's going on?
Okay, so we're in a time of where the government says choose wisely, which essentially means don't really test too many things because it costs money. But
That's
also
why
it
they don't
depends.
want to do blood work, I'm assuming.
Right. And then,
Yeah.
you know, so I'm going to say a lot of doctors don't really look broadly at the whole picture. So, because there's a lot of nutrients can be low and make you not feel well, like low B12, low magnesium, you know, your thyroid can be off. There's all these little things that add up. And then, in terms of looking at hormones, because like what are the biggest thing I get all the time, you know, is like the right conventional doc says, well, there's no point testing, right? But, you know, because in a woman's cycle, there's fluctuations that happen. And you kind of need to be a little bit of an expert to really understand what's going on every day of your cycle. So I used to work at a fertility clinic. And so I used to help out with cycle monitoring. So I understand the nuances and trying to find out where somebody is in their cycle. So, you know, if somebody has a 28-day cycle where it's very easy, if they're doing the standard thing and, you know, the hormones are low at the first week of your bleeding, then they start rising around ovulation, peak at ovulation in terms of estrogen, and then it drops, and then there's a second peak. And then progesterone's only produced if you actually ovulate. And then there's looking at ratios in the, like we'll say the standard 18 to 21 days when we want to look, but really, you know, especially in perimenopause, it's a moving target. So kind of like, did we catch the blood work at the right time?
Right.
So blood work you know, I've seen so many people who have blood work, and I look at the blood work because you look at, like, you know, the FSH, LH, estrogen, progesterone, and you can look and go, oh, well, this wasn't totally done at the wrong time. They thought they were at the right time, but perimenopause, like, all of a sudden it's after the fact that you know where you are, right? Like, you might think you have a 28-day cycle, but this month, oops, it was 36. So the window's off.
Right.
So there's so many nuances to sort of figure that out. But, you
Yeah.
know, often, you know, to sort of know if it's perimenopause, I mean, it's really, you know, um, are you having heavier, like the easy ones are like, are you having really heavy periods? Are your periods really wonky?
Yeah.
You know, are you getting PMS and it's a certain time of the cycle? Like, those are the easy things to identify perimenopause.
Yeah.
What are the more difficult is the irritability, the anxiety, the depression, brain fog, the weight gain, the palpitations, the other pieces, right?
Yeah. I'm very fortunate too. I am working with Shari myself, and I'm really excited about this because we've done 2 rounds of blood work, one at the beginning of the month and one going to be at the end of the month. And I'll share what we find, because it'll be very interesting to see what the difference is going to be when we get the second set of results. So yeah.
I guess what I wanted to ask, because, you know, first of all, this Hot and Hormonal is intended for women in perimenopause, late 30s to mid 50s, maybe late 50s. Everybody's different. And so we want you guys to tune in, because we're going to talk about a variety of topics and also share our own personal experiences. So for Carla, what did perimenopause feel like in your own body before you even had language for it? And by the way, I'd love you to chat about your own experience of what the doctors told you and why we are choosing to work with Dr. Shari.
Yeah, so I was just going to a regular doctor. I couldn't get in to see anybody that was specializing in HRT at the time. This was in 2022, and I instantly felt like all of a sudden I gained all this weight and nothing had changed. I didn't eat different. I didn't stop exercising. Everything had stayed the same, but I think what the problem was, now that I understand it, is that I didn't make any changes to my lifestyle. So I was eating and exercising the way that I would in my 20s and 30s. And now my body needed a different approach to higher protein, maybe less carbs, a little more fats, less HIIT workouts, less HIIT cardio sessions, which was, I think, must have been putting my body into high stress and increasing my cortisol. So I had just gained almost 15 pounds, seemingly overnight. Like, obviously it wasn't overnight, but it comes so quickly.
For a fitness instructor and an avid, like a pretty strict, a healthy lifestyle, because she was literally running KG lifestyle. So and then here she is going through her own, like, what in the heck, right?
And then I got endometriosis, and that's what actually helped me find out what perimenopause was. As I was Googling what endometriosis was, I found perimenopause. And then I started going to doctors, and they said exactly that they didn't need to test my blood work because it really didn't matter. It wasn't going to tell me anything because our hormones always fluctuate. And basically, this is how you're going to feel. So suck it up, princess, you're getting older. And that's just how life goes. And I'm like, no, not going to happen. I don't believe it, because I was dragging through the mud every day. I was like exhausted. I'm a very happy, naturally person. And I felt so sad every day. I just felt like Groundhog Day every day. It was like I didn't have energy. My little spunk was gone. Everything fell apart for me. So.
Right. And I'm going to say it's very similar story in that, like, a lot of my patients would come to me in their 40s complaining of weight gain and fatigue and whatever. And I would be like, oh, well, you're not eating right. You're not exercising right. Like, you need to do, you know, whatever. And then for me, I was 44 when I started getting a lot of symptoms, and it wasn't the typical. So I was still having regular periods, and I wasn't having hot flashes, but like, I had brain fog, I had fatigue, I had weight gain. And then it was an aha moment when I went, oh, it must be hormones. And that
Right?
kind of is what started me on my journey to learn more about bioidentical hormones, because also around that time was the same time that WHI came out that said all hormones carry risk of increasing risk of breast cancer and stroke. And my mom died at 44 of breast
Oh
cancer.
my God, I'm
So the
so sorry.
last thing I wanted to do was take
Oh,
hormones.
yeah.
And so that's when, I was at a big conference, and they were talking about how hormones increase your risk. And then I stood up in front of like 400 docs and I said, wait a minute, wasn't there like the PEPI trial and this trial that showed natural progesterone was very different than Provera? And then so has there been a study to show that they're the same? And they said no. So then I was, well, how come you're making this statement that they are? And so that's what started me to learn about bioidentical hormones, which then led me to functional medicine. And to me, that was like, yeah, the veil was taken off and it was a new way
100%.
of thinking, and it made a huge difference. And then, so when I started learning about the functional medicine and use of bioidentical hormones, that's when I started doing that for myself and noticing the difference. And one of the first things I started was progesterone.
Yes.
And so, progesterone, if you're low on progesterone, you burn like 300 calories less a month, less a day. So that's where if you're
Wow.
doing everything the same, you can be gaining
Yeah.
weight. And then
Yeah.
it's your natural tranquilizer and your sleep aid. So
Yeah.
you're, lighter sleep, more irritable. And when you don't sleep well, then,
Oh,
you don't restore and regenerate. And then you're more insulin resistant and cortisol. And it's all
exactly. It
intimately
snowballs.
related.
Yeah. With the HRT, I want to kind of decode who who it helps. Should everyone be on it, and who should be cautious, if any, of it? So that people can see if that would maybe fit their lifestyle, and what kind of approach would you say they should take to figure this out?
So again, I'm a little different than, I'm going to say, a lot of docs who even do hormone replacement, right? So a lot of doctors, feel that anybody who's obviously coming to them with symptoms, and again, they're more trying to address the hot flashes and the heavy periods, and then they're kind of giving hormones. Actually, a lot of doctors might actually give estrogen first, because in their mind, estrogen is low and that's causing the problem. But in fact, estrogen is bouncing around, and women in their late 40s can actually make 30% more estrogen. And it's actually estrogen dominance, like the estrogen relative to progesterone. That's the problem.
Right.
And in terms of, you know, someone's giving
I
them,
was just gonna
fanning
say she's
themselves. You
having
having
a
a little
hot
hot flash here, are you?
Here's the thing. I not to interrupt. I actually have never yet experienced a hot
you
flash,
are now.
but however, I do get hot, right? Like I do. So
Right.
it's not like I'm waiting for the hot flash. Trust me.
Well,
And
what you just did,
a lot of
that
women
is
are
a
like,
bit of a flash,
I'm over here
honey.
freezing to death.
No, that's a flash. So, I mean, there's obviously extremes where you can just like drench and have
Wow,
this
I
Right?
haven't had that yet.
soaks. But a lot of people, that it's an early stage, like feeling warm and all of a sudden, and
I
wearing a
look at
tank
my
top
temp
when
like,
everybody else is wearing sweatshirts, right?
right?
So those are signs.
my
Um,
body's confused. So at home, I get a little chilly, and then I'm like, I'm gonna put on a sweater, or oh shoot, now I'm sweating. I'm gonna take off the sweater. So from that perspective, my body temperature is messed up because I don't know how to regulate my body temperature. So
right. So that
that's not
is
something that I battled with
that's a
before.
fluctuating estrogen thing. So,
Yeah.
Let's go back a second. So, you know, a lot of people think perimenopause is low estrogen. It's not. It's fluctuating. It's bouncing around. And it's the rapid rate of change that causes the flash. So if it goes from low to high and then high to low, so that will happen right around ovulation. And that's going to happen right before your period. So a lot of women, like I even in myself when I was 36, I remember having these flashes and sweats around those two windows. And it's because of the, you know, around ovulation, your estrogen shoots up and then it drops. And then right before your period, it drops again. But, and so low estrogen doesn't cause hot flashes. You know how I know? Men and kids have low estrogen, right? Are
Oh,
they having hot flashes?
right?
No, it's because it's the change. And then if you're used to being up here and now you're here, well, that's the change too. So,
Yeah.
so who you again back to who would benefit from
Yeah.
hormones? So anybody and everybody is the bottom line, but it's, you know, some people do well. So it depends how symptomatic. And so if somebody's symptomatic where it's hot flashes, night sweats, vaginal dryness, you know, mood, sleep, irritability, weight, like all of those things are entitled to treatment. If
Right.
you come to see someone who does more of the functional medicine well-being, would basically likely balance your estrogen and progesterone. And you can do that in two ways. One is get rid of the excess estrogen. So fiber, you know, something, there's calcium D-gluconate, there's other supplements that help with the metabolism and excretion. And then there's things to raise progesterone. And again, there's vitamin C, there's supplements, and then actually taking progesterone. So for me, one of the first things that we'll do in perimenopause is often, you know, try to figure out that balance and improve progesterone. And I only start giving estrogen when their estrogen's consistently low, or they're having such bad hot flashes that the progesterone then fix, and then I'll add it back in. But women who are in perimenopause may stop ovulating, and there is a certain amount of estrogen you need to hit to cause ovulation. So let's say you're having all these symptoms, we're already on progesterone, and then I give you estrogen and you haven't been having a period. Guess what? You can start cycling again because I just raised your basement to
Right.
the level that you can ovulate. And then when you start ovulating again, you can have bursts of really high estrogen, and that's why they start complaining of breast tenderness or headaches or bloating.
Can
So
women have
that,
babies? Well, can
huh?
they? Are they because they're menstruating? Are they susceptible to, like, for people who are women who are in perimenopause? Like in my matchmaking business, there's women that you know, hadn't found a partner late in life. They're still hopeful of having
So I'm going to
children.
say the answer is yes. And
Okay.
so that's where, you know, between like the teenagers who go for abortions, the next highest levels are those perimenopausal women who don't think they're fertile,
Right.
right?
Well,
So the
my
only,
daughter, I had a daughter at 44. I was in
Yeah.
perimenopause, and but I mean, she's here alive and well. And
Yeah.
I had that reaction, Dr. Shar. I was like, "What?"
right,
What
because
is
you don't have a period for a pit and you're like, oh, I'm menopausal. Oops, I'm pregnant.
exactly what happened? Like and I'm like, I thought it didn't work anymore. And it's like, nope,
It's working.
it's all working. So that's something. So ladies, if you're thinking like me, I wasn't thinking. You know, the funny thing is, I had a flood of messages of women who were trying to get pregnant saying, "What did you do? Did you take hormone?" I'm like, I had unprotected sex. That's what I had. You know. Anyway,
Yeah.
that's crazy.
Question on a link between gut issues and perimenopause. Is there a link between that? Because one of the biggest things I noticed, and I'm not menopausal yet, I'm obviously still in that peri stage, was gut issues. Is there a reason why that gut microbiome changes during this time?
So, okay, so number one, gut health is almost imperative to everything in the body, right? So if
Yeah.
your gut's inflamed, your brain's inflamed, your body can have a whole bunch of stuff and hormones can be off whack. But again, estrogen dominant. So you had endometriosis, which is another sign where you generally have way more estrogen than
Yeah.
progesterone. And so when you're estrogen dominant, that's where a lot of women will complain of bloating, even reflux. There are things that are happening that can cause that.
Right.
So
So there is
why
a
that
risk.
is, I'm sure there's a
Exactly.
physiological reason for that, but I can tell you there's a lot of women who will talk about the weight gain, the gut bloating, difficulties. And so, it's something that go hand in hands. And again, what are things that can help get rid of excess estrogen is fiber. What does fiber do to our gut? Depending on the type of fiber, it actually helps grow good bacteria and helps us evacuate, right?
Right.
So actually the estrogen, one of the pathways is that you use it, it goes through what's called the enterohepatic pathway, meaning it's going through the liver and then into the bowel, and it could be recirculated if you have poor gut bacteria or not the optimal gut bacteria. So you're actually causing much higher estrogen levels, and that adds to the estrogen dominance.
Right.
So poor gut health can augment estrogen dominance and also vice versa. And so
And you offer at your med spa
vitality.
a
Yeah.
treatment, yeah, or not treatment, I guess treatment, yes, but also testing for the GI tract as well, don't you?
Yeah, so we do more like what we call functional gut testing. So one's called like a comprehensive stool analysis. So it's looking at the gut microbiome. It's looking at gluten antibodies. It's looking at calprotectin, which is looking at whether somebody has inflammatory bowel disease. It's looking at vitamin A levels. So it's a very comprehensive test. And it's very unfortunate that our OHIP covered tests really, like when they're doing stool samples and even parasites, like it's not at the same degree. It's not the same
Yeah.
level of testing. So you could be told you're fine and
Yeah.
then do one of these tests, which are either DNA or RNA testing or like, so there's different methodology. And
Right.
so it's using the same technology that the microbiome research is using. So
On the topic of stool, let's stay there for a moment, okay? Because
we'll talk about
yeah, let's
anything.
talk,
Yeah.
let's talk about stool. And this is a real concern for me. Okay, I'm gonna get personal with my stool here. What should be for for any human? I don't know that it should be different for a perimenopausal woman or man. I'm not sure if men's stool is different than women's stool. What is a healthy amount of times to evacuate? And should the consistency of the stool be hard? Should it be, sometimes it's hard, sometimes it's pebbly, sometimes it's watery. What's the actual consistency to know that, oh, look, I have a healthy stool? In the same breath, if your urine is a dark yellow or it's like a very dark in color, my understanding is if you're properly hydrated, then when you pee, it should be clear, right? The urine should be clear. Now maybe a little bit yellow, but if it's that
Okay, don't give me two questions because then I'll forget.
okay, yeah,
I am menopausal, right? Okay, so in terms of stool and evacuations, I'm going to say anywhere from 1 to 3. In terms of ideally, it should be like fluffy, not hard, not like rabbit stool, right? So that also gives you an idea of hydration and fiber. But everybody does have kind of their own rhythm. And I can tell you that like years ago, I would go once every week or one every 10 days. And, it was, oh, actually, I have low thyroid, so there are things to like magnesium, making sure your thyroid's optimal, and then certain things like taking iron can increase constipation. So there's medications and then hydration level. So all of it affects, and I think fiber is the biggest one, right? So if you're not going every day, then you're actually accumulating more toxins in your body, right? So how do we get rid of toxins? So number one, let's start that actually toxins are a real thing. And, you know, I used to give lectures for mother risk, and, you know, so Canada, US, we do biomonitoring in blood, and so cord blood, regular blood, and breast milk. And, you know, when I used to lecture for obstetrics, you know, 25 years ago, it was like there was 274 neurotoxins, just neurotoxins, not about all the toxins. And then, you know, lecture, it was 375. And so the number, and that was a long time ago, and we have way more toxins now than before. So how do we get rid of toxins? So everybody is, their ability to detox is genetically determined. So it's, you know, works on phase 1 and phase 2 of the liver, glutathione pathways. So one is you can do genetic testing and kind of know where you're at in terms of detox. But also we detox through our skin. So sweating helps get rid of toxins. Peeing can get rid of some toxins, and pooping. So yes, you want to poop regularly. And you want to make sure you have enough fiber. So that's another thing to grab to get out and go in terms of urine and hydration and color. So, you know, yes, having not such a dark urine, like if you do, usually means you're dehydrated, but also don't forget if you're taking B vitamins or other things, you can have dark urines. If you eat beets, some people will have a nice red colored urine. So there's different things to that. And then, you know, and then if you have high blood sugar, you might pee all the time and be very dilute. But that's not necessarily a good thing. So it's kind of in between. So.
Well, my question now is for Carla. Carla, what would you say are the top 3 complaints that your clients bring to you, or the reason perhaps they call you, with regards to perimenopause, like thinking it was maybe stress? Like, what are the top 3 complaints women come to you for?
So weight gain is the first one, low energy, and brain fog. Those are the 3 top that all the women I work with say, and they need help. And a lot of the time, when they finish the program, that corrects most of it. But then, and this is why I partnered with Shari, because I wanted to have a doctor in place that I can send my clients to that want to explore after they've finished the program and got their nutrition locked in, their exercise regular, their sleep patterns kind of into a routine. Then if they're still not feeling top notch, or their body's not working optimally, then it's time to explore the next phase. And that to me is HRT. Because for me, the same thing, like I was feeling all those symptoms, and the sleep was one of the big things, like you mentioned, Shari, because everything then was off. I wasn't able to function, which was causing the high cortisol, and then the brain fog. Everything was like spiraling from the no sleep. So I started progesterone, and that completely changed everything for me. And that's kind of where I want to help these women, is to the next phase of where I can't help them and Shari can.
And another place where Shari meaning VitalityMD Toronto, guys, VitalityMD Toronto,
amazing
can
place.
help, is where it is in the libido, in the partnership and sexual benefits. What I'll explain that, because we didn't talk about, you talked about some women experience vaginal dryness, right?
But let me back up, because you've asked her what her 3 complaints from her clients. And I will say that it is very important to address all those things that you just said: diet, lifestyle, exercise, right? Meditation. Because those are first steps. So those are the things that we need to do in partnership and, you know, fix. And that can fix a lot of things, right? And then, so my biggest 3 complaints would be low libido, fatigue, and weight gain, right? And a lot of them have similar underlying problems, right? If you're stressed out, it knocks off your sex hormones. You don't feel like having sex. It also causes weight gain. Like everything is intimately related. So, you know, I think like Carla can get going and make huge leaps and strides in making you feel better. And then if that's not working, it's not just hormones to look at hormones. It's really looking at the whole comprehensive look to look at inflammatory markers, metabolic markers, nutrient deficiencies, and your hormones,
Yeah,
right? So that's what I think sets me apart, or Vitality MD apart, from just going to any just hormone doctor, right? Or
exactly.
gynecologist, right?
No
So
more than that.
so
Yeah.
like if you want to have optimal wellness and longevity and vitality, that's really what you need to do to up your game.
Agreed.
Yeah, I
100%.
love that vitality.
Yeah.
And to that point, two of the solutions to some of these challenges, I am actively doing and in participating. I'm midway my own experience at Vitality MD. In fact, this morning I was there for my fourth session of Exomind, my fourth session of Emsella. Emsella, am I saying that correctly?
Emsella, yeah.
Yeah, Emsella. And so, can
The
you just
Kegel throne.
yeah,
The
all right,
Kegel throne, or
yes.
Dr. Oh my God's chair.
Yeah. Well, this is very relevant to the conversation. So, would you mind sharing with the ladies what is the Emsella chair and what is the Exomind? And I will share with you how I'm feeling already in the time that I've spent there. It's been amazing.
Okay. So I'll just kind of step back for 1 second, then talk about that. So basically, perimenopausal and menopausal women, unfortunately, get hit with almost everything, right? So, you know, our hormones are off whack, we gain weight, we're complaining of depressed mood or anxiety, we're not sleeping, and we're gaining, you know, and have brain fog, right? So, and low libido. So, you know, so at Vitality, we kind of have treatments and technology to address all of those things. So I always like, you know, a comprehensive wellness assessment and plan is great. But, you know, what's been great, things that we incorporated to help people even go to the next level. So one is Exomind. So Exomind is TMS, transmagnetic stim. It's been around for 40 plus years, but originally it was only used for treatment resistant depression, meaning only given to people who weren't responding to their antidepressant. Now, fast forward, there's newer devices out there that can deliver treatments in 6 sessions, 24 minutes, and help with anxiety, depression, improve sleep, help with food cravings, regenerate new neurons. It works on the emotional regulation and executive function. So it's a great add-on. And then there's the one of the tech, but we have many tech or things to help with vaginal health that, you know, we may get to in shortly. But Emsella chair is one of the things that we have. So that device that causes 11,000 perfect kegels in 28 minutes, and all you have to do is sit on a chair fully closed. And why do we care? So as we have kids, you know, vaginal births, you might blow out your pelvic floor, or lifting heavy weights can also blow out your pelvic floor. And then things that you might experience is, you know, stress, or your stress or urge incontinence, or you know, nocturia, which means peeing all the time. You may have more difficulty having orgasms, because the strength of the pelvic floor is in part of having an orgasm is to be able to contract those muscles to get you to the next level. Also, the pelvic floor is part of the core strength of your abdominal muscles. So the Emsella has a Health Canada indication for stress urinary and regular urinary incontinence, as well as sexual health. So we're participating in a study that's using Exomind to help with all the cognitive and weight and mood issues, and then incorporating the Emsella chair to address all the other things that potentially happen in perimenopause and menopause. And Carla, sorry, Carmelia is part of the was a lucky participant, and she's participating in the study. So she can tell you now. She can tell you her experience so far, and that things will continue to get better over the next 3 months.
I mean, if they're going to get better in the next 3 months, I'm so excited for that. I will say this, the biggest impact I can feel definitely is the impact of the Exomind. You were correct in saying that my sleep would be a lot better. I used to struggle with falling asleep. I'm having more dreams, and they're nicer dreams. I used to have nightmares. They're actually nicer dreams. I can't say that this is going to be everybody's impact. I have a high stress in life. I have an elderly mom. On Friday this past week, I had something pretty tragic happen to me, theft of some of my personal property, which I discovered. And normally, if something like that would have happened to me, I would have been like very angry.
Flying off the handle, right?
Carla was one of the first people I called, and I said,
I was shocked. I'm like, you're so calm. She was like relaxed, focusing on the positive sides of everything, and I'm like, babe, like, this machine is working.
Yeah. She didn't even.
It helps with resilience. It helps with resilience, and like decreases reactivity. I mean, life still happens, but at least you're not flying off the handle.
Falling apart. Yeah, like, she was able to keep her shit together, basically, and think clearly, and execute what she was going to do going forward. And I was like, wow.
Like how the former me would have reacted in a 10 out of 10 to a situation like that, and I would probably say it was a 3. Yeah, like I was a 3 or 4, and it didn't last very long. And so that's one of the big benefits. Now, of course, with the Emsella chair, first of all, it's both experiences are really relaxing. Okay, lying down with the Exomind, it's very relaxing. It's not painful at all. I get to sleep for 22 minutes, and that's great. My mind is clear. And then same with the Emsella chair. It's a massage for your vag. Okay, it's a really nice massage for your buttocks. You were going to share with me how it helps with the butt too, and I'm interested in that. For the buttocks area, for the perineum, is that my saying?
Perineum, yeah.
The perineum area, all different cycles, right? It's not the same thing, and sometimes it's like, whoa, okay, this is great. Like, it's not going to trigger an orgasm, but I could say it's pretty pleasurable feeling. It's not like it's not at all painful. Okay.
Yeah.
And
no. It's
already, I think it's already had an impact on me not having to release before I go to the bathroom, or having any kind of like small hip mishap if I'm exercising or whatever. And so far, so good. So thank you for that. I'm having such wonderful.
Yeah, and so you're going to build muscle over the next 3 months. So whatever results you have will continue to get better and better, right? And then, it's great for any age. So, especially after having a baby, because like we blow at our pelvic floor, they're weak muscles, and, our body shape changes, and that kind of just helps bring it back. Helps with lubrication, and so sex, and then just not having leaking with like coughing, sneezing, or jumping.
Yeah. Sorry? So it's good for not just perimenopause, like new moms. So I have a lot of
new moms, or like men actually benefit too. So I didn't appreciate that men have leaking too sometimes. So weight training. So if you're like lifting heavy weights and you're not supporting your core properly, you definitely, that increased pressure, abdominal pressure, blows out the pelvic floor, so men can get leaking. It also helps men with erectile dysfunction. Wow. Post prostatectomy, it also helps with the leaking. So that's men. And then for women, so after having a baby, as we age, our tissues get more soft and loose, and also because of the lack of hormones, and that, women may not have a problem. They may even have a little bit of prolapse starting. And so if we can build the pelvic floor muscles to help support, it's also very beneficial. And then we also have a program called Core to Floor, where we use the Emsella chair to help the pelvic floor strength and the Emsculpt Neo builds the muscles of the abdomen. And so basically for the elderly, the frail, people who have sarcopenia, which means low muscle mass, all of a sudden we're increasing their strength. They can get in and out of a chair much easier. Their balance is better, less risk of falls. So really,
Everybody benefits.
everybody benefits, and everybody can benefit from Exomind. So high executives, high pressure, have to be at the top of their game. If you actually look at I think it's NFL and NHL, a lot of the athletes are now using Exomind with the Emsculpt Neo. Courtney Cox, Kim Kardashian.
Oh, wow.
Gwyneth Paltrow. So there's a ton of celebrities who are both also using a lot of the tech that we have, and they're being spokespeople. They're talking about it, and the women specifically are really pushing the Exomind for brain health, resilience, perimenopause and menopausal symptoms, and even the Emsculpt Neo, which is to build muscle, because again, in perimenopause and menopause, we lose muscle. So, great if we can do exercise and be like Carla and do all that. But if we are injured or don't have the time, whatever, we have the technology to help support
Exactly.
that as well. So it's actually a great compliment, because sometimes, I don't know, Carla, you might be able to speak to this, but I work out and then, but I can never activate my butt. And with the
Yes.
devices now, I've
Does that.
stimulated those muscles. So now when I go to work out, I'm able to engage them.
100%. Yeah, that's huge actually, because a lot of women will say, I did my glute workout. They'll come to me for training and they're like, but I didn't even feel my glutes. I more felt my legs. So that's a huge benefit. And you offer both of those at your studio.
Yeah.
And do you do the abs too? Because I know.
Right. So the Emsculpt Neo can basically do abs, flanks, triceps, biceps, inner thigh, butt.
Wow.
So it does a beautiful butt lift. And then we also have a BBL that's non-surgical, where you do Emsculpt on the butt and the Emsella on a very unique way to use it, that we get this nice little booty lift. You can do on terms of, your quads. And so also great for patellofemoral, because a lot of women our inner thigh muscles are weaker than our external. And sometimes they can never get that. So you can do the Emsculpt on that inner thigh and then strengthen that. So then the knee cap tracks properly too.
Right, that's amazing.
I would tell you, I just never want to get off that chair. I want to have 44,000 kegels a day. That's pretty much what it is. Okay, we have a question.
Question about back to the HRT. What would you recommend? So somebody comes to you and you guys make a decision that you're going to start them on HRT, whatever that is. How do you choose between the patch, the pill, the cream? What's the difference between all of them?
So again, depending if they're peri and I think I usually start with progesterone and I give them the option of pills or cream. I go over what the pros and the cons are. So again, because I deal in bioidentical, I will compound creams. I feel very comfortable with that. And then, conventional doctors feel better with the pill. Why? Because when you swallow a pill, even though you're taking 100 milligrams, you're probably absorbing only 10, but we can measure it in the blood. When you do cream, we can't. But I look for symptom relief. I want to talk to my patients. Yes, I use my labs, but I want to make sure I'm not overdosing someone. So, it's a little more individualized. And then in terms of, when we get to the point where we're using estrogen, I personally, like, so years ago, we were using more oral estrogen. I would not use oral estrogen. It increases clotting factors, so increased risk of stroke and cardiac. So it's all transdermal. And then there's Health Canada approved, so there's the Divigel, which is a gel, there's Estrogel, there's the patch. And then we can also compound, and often sometimes compounding might use bias, which is estradiol with estriol. So I work with each individual. I want to know what their goals are, what their wishes are, what do they want to try, and I stick my 2 cents in. And it's very patient centered, right? It's not me being I'm telling you what to do, and this is what you do, and there's only one way to do it.
Exactly. You communicate and decide together what works best for the individual. I love that.
Yeah.
Yeah, we've jumped on a lot of different topics. Carla, I want to talk again just about the libido, because for Shari, one of the top concerns or complaints is the low libido. Yours is low energy. Carla, how do you coach women who feel disconnected from their bodies and their partners while they are navigating their hormones? And how, share maybe a story about before and after.
Yeah, so I had a client came to me, and she hadn't been sexually active with her husband in over a year. And it was one of the reasons why she came to me, and she literally broke down on the call because she came to me for weight loss, but she didn't realize we were going to get into that conversation because I made her feel very comfortable to know that she could speak about anything. And, I always ask them, what is their most painful reason why they are here? Like what is it that's really bothering you the most, and why has the weight been an issue for so long? And a lot of they just don't know what to do. They throw spaghetti at the wall, nothing works. Then it boils down to it being their hormones, and obviously probably low libido due to the hormones plus the weight gain. And then they just become distant. So she stopped being sexually active. She didn't feel good in her body or her skin. So after we did my program, she lost 20 pounds in 6 weeks. A lot of the weight they lose in week 1 is just water weight because their body is inflamed and they're carrying a lot of extra water. So anyway, long story short, she's now very active with her husband and she feels better than she ever has. And she said one of the other things is this was at Christmas, and she was feeling like she didn't want to take pictures with her family for family photos or anything, and she was hiding in things. And so it was really rewarding for both of us to have her completely change that whole part of her life. And she sent me pictures of her and her husband, her and her kids, and she had this cute little dress on that was all tight here. And anyway, so it was that, I think, was the most amazing story I have on how it transformed not just her weight, but her whole relationship with herself, her husband, and her family. And so that was
right. So I think for her, it was her self-confidence, her body image, right? So that there's that. So I think you did a great job of helping her, and through, I'm sure the diet, the exercise, the whatever, right? Yeah. That fixes some of the hormones. But I also see a lot of women, unfortunately, who have the vaginal dryness, the vaginal atrophy. I see a lot of women, unfortunately, with lichen sclerosis, that it's an autoimmune condition down there, and it tightens. And it's kind of, if you don't lose it, if you don't use it, you lose it. So again, hormones, there's different options. There's non-hormonal options and things that you can apply, like CO2 Lift V that we offer, and give patients a nice discount if you come and get that. We have hormonal options, and then we have a lot of tech. And we also have the O shot, which I love and is brilliant because it's PRP, it's regenerating the tissues, help with lubrication, help the ability to orgasm, and it helps turn on the head.
Wow.
Right. So
where does that shot? Where do you get that?
So it's PRP, platelet rich plasma. So how we put PRP on our face or on our hair. Well, it's injected in the private area. So
Wow.
there's like a clitoral shot, a shot into the G shot or suburethral. And then I specifically target to the individual because every woman's dryness and issues are different. So some have laxity, some have tightness, some have, tears. So I fix all that.
Amazing.
And yeah.
So where can everybody reach out to speak with you? What's the best way to get a hold of you, to book an appointment, to start their path to their best, happiest self, no matter what stage of life? Because like as we chatted about, there could be moms that need some help on the pelvic floor, or there could be perimenopause or menopause. So where would be the best way to get a hold of you? Sorry, what would be the best?
Well, I'm going to say VitalityMD.com is the website. It talks about everything there. We have the great bot, Olivia, who will give you tons of information. And then usually you'll then get a text or a call from our office. You can call our office directly at 416-792-1100. You can follow us on VitalityMD Toronto. You can comment, you can DM us, but the best thing is to
through me too, because
and
now
obviously yes, through Carla and even Carmilla, very supportive of them. So I think that a lot of what we do helps them and vice versa. So love the collaboration.
Me too.
Well, listen, this time flew by so fast. And before we cut everybody off, I just want to remind everyone, this is Hot and Hormonal. We are live every week on Instagram. We will distribute some of this content across all of our social platforms. Definitely want to have you back again.
We have so many more things to cover.
I want to talk about my results.
Me too.
And she's going to go through
so I've got some things coming up. We have an appointment probably the end of March, beginning of April, and I'm going to share my blood results, what we found out, what we decided to do treatment-wise, and keep you guys in the loop, because I think when people share their own experience, it helps you to maybe realize what you can do to help yourself, or, to where to reach out. So I'm super grateful to have met Shari and be working with you.
Same. You guys are doing a great job. You look amazing.
Thank you.
It's a nice thing. Thank you. Well, the thing is, so I'm 60, so this is what 60 could look like.
Okay, so I'm turning 54 next week.
Happy birthday.
And I've had 4 babies. My eldest is 27. And when we go out, people are like, no way, she's your mom. And I'm like, come on now. Anyway, we really we're speaking for all ladies and the men who are married to or coupled to these ladies. This isn't just if you're single, if you're married, if you're a woman, if you're a female, you're going through these issues, or you know someone. Please please share, please tag. We're here to support you. You don't have to go through it alone.
Nope.
It's been an amazing experience for me to have my girlfriend and weight loss expert in perimenopause, and now Dr. Shari Caplan, who has been helping my mind, my body, my vagina. Thank you so much.
We just love you, Shari.
All right,
anyways,
guys.
thank you very much. The same. I really enjoyed talking. Love to talk. You can't shut me up once I get started.
Yeah, I love that.
Okay, guys. VitalityMD and KG Lifestyle. We're out. Bye.
Bye.